Paul, we're now live. You can go ahead.
Okay, well, good afternoon, everybody, and thank you for joining us today. I'm Paul Gullickson, Communications Manager for Sonoma County, and this is our COVID-19 update for Wednesday, May 11th. Let's begin with a brief message from Sylvia from our communications team for our Spanish-speaking viewers. Sylvia?
Gracias. Hoy esta reunión será interpretada simultáneamente al español. Para activar la interpretación, busque el símbolo del mundo en la parte inferior derecha de su pantalla y haga clic para seleccionar español. También puede escuchar la reunión en español en el canal de YouTube del Condado de Sonoma. Puede encontrar el enlace en la página de Facebook del Condado de Sonoma. Gracias, Paul.
Thank you, Sylvia. Well, like most of the country, COVID cases here in Sonoma County are on the rise. And as you may have seen in the news, we've even had some outbreaks in our local schools, which our county health team is tracking closely. The good news is that this wave of cases is really unlike the surges that we have experienced at other times during the pandemic, and for good reason. And we'd like to talk more about that during our briefing today. We also would like to update you on some transitions that we have occurring in our overall COVID response and how we are shifting to more targeted outreach in terms of county-supported vaccination clinics. For example, since our last update, our fixed vaccination clinic in Rohnert Park has now closed and has been replaced with a mobile clinic at the Rohnert Park Community Center, and that is available on Tuesdays, Thursdays, and Saturdays for those wanting vaccines or boosters. Appointments are available, but walk-ups are welcome. So please know that that is available to you. We have other changes and vaccine opportunities that we'd like to go over as well in today's update. But first, I'd like to go to Dr. Sundari Mace, our health officer, who will talk about our current case rate and guidance about what we should be doing in response to this latest wave. After Dr. Mace, we'll hear from Dr. Shende, who will give us an update on our vaccine efforts. And then we'll hear from Kate Pack, our chief epidemiologist, who will walk us through some of our latest data concerning COVID and vaccinations. And if you have questions, please submit them to publicaffairs@sonoma-county.org. That's publicaffairs, one word, @sonoma-county.org. And we will get back to you as soon as possible. So let's start with Dr. Mace.
Great, thank you so much, Paul. First, let me reiterate that we are seeing widespread transmission occurring in our community. But this is not like the surges that we've seen in the past. While our case rate is now 26 new cases per day per 100,000 residents, that's still just 1/10 of the case rate that we had in January. At that time, our rate was 256 new cases per day per 100,000. For a county of our size, that meant that we were seeing around 1,300 new cases every day. We also want to point out that this wave, while concerning, was expected. We watched for the past 2 months as cases climbed in Asia, in Europe, and the East Coast, due primarily to the spread of the BA.2 Omicron subvariant. We also saw cases rise significantly in some of our neighboring counties, including San Francisco. So we knew we were likely to see our numbers go up in our areas as well. This is particularly true given the change in guidelines that occurred in March in our workplaces, schools, and elsewhere, when we transitioned away from having masking mandates. We expected to see our numbers go up. Still, it's concerning. Many of you, like us, are hearing about friends testing positive. And although we've not seen the tragic outcomes, including hospitalizations and deaths, that we were experiencing before vaccines and boosters were available, we are seeing widespread disruption in our daily lives, including at work, at school, and at home. This recent wave is a reminder that we're still living with COVID in our community, and likely will be for the foreseeable future. According to the Centers for Disease Control and Prevention, roughly 60% of Americans have had COVID at some point. And unfortunately, we still have quite a number of people in our area who are not vaccinated. So one of the main questions we're hearing these days is, what should we be doing to protect ourselves, especially those who are senior citizens or who are immunocompromised? First, I strongly encourage everyone to continue wearing their masks, particularly in indoor public settings with large groups of people gathered close together. This is especially important for protecting those who are elderly and who are immunocompromised. High-quality surgical or N95 masks are still strongly recommended. For the rest of us, please help protect those who are most vulnerable by wearing masks around them. And let's be respectful of those who choose to wear their facial coverings or masks, regardless of the setting. You don't know what reasons they may have for wearing that mask. The fact is that they may be trying to protect you and the community. But the number one most important thing you can do, if you haven't done so, is to get vaccinated against COVID. And if you're eligible, get your booster shot. One thing we know for sure is that vaccines work, boosters work, and they have been a critical tool in our community's overall ability to return to normal life while COVID still exists. Those who are unvaccinated in Sonoma County are not only much more likely to get COVID, but they are 18 times more likely to end up in the hospital and 13 times more likely to lose their life if they end up getting sick with COVID. The main reason we're not seeing the high rate of hospitalizations and deaths that we were 15 months ago is because of the availability of vaccines and boosters, the protective effect of vaccines and boosters. We heard earlier this week that since the beginning of the year, Sutter Hospital in Santa Rosa has not admitted a single COVID patient who has been vaccinated. That alone underscores how important it is to get vaccinated right now. Finally, I continue to encourage you to get tested if you have symptoms or have been exposed to a COVID positive person. And if you test positive on an at-home antigen test, please report the results to the county by going to the county's website at socoemergency.org and finding the COVID testing page. At the top of that page, you will find a link to a form that says self-reporting your at-home antigen testing results. By getting those results reported to us, you'll ensure that we're able to have a good handle on what's happening with COVID in our county. The good news in all of this is that although our case rate is up, our hospitalizations continue to remain stable and low. As of this week, 23 people are hospitalized with COVID, with 4 in the intensive care unit. We haven't had a death from COVID in nearly a month. Thanks to the protective measures we've taken, Sonoma County's death rate remains low compared to California State and the nation. If you look at our COVID death rate per 100,000 residents here in Sonoma County, we have had 56% fewer deaths in California as a whole and 67% fewer deaths than the nation as a whole. This is really very remarkable, and it's a tribute to all of you and the work that you have done to protect yourselves, your families, and your neighbors, and to save lives. And it really is a tribute to all of the partners that have been involved in the response to COVID. And I want to thank everybody for that. It's because of this that I still believe that we're in a much better place than at any time in the past 2 years. And I'm optimistic about where we're going. You never know what awaits us in terms of new variants, but looking at the various state models, it appears that this wave will likely peak around the middle of May. So I'm cautiously optimistic that we should start to see our case numbers on the decline again soon. That said, we still have work to do, including a continued push for vaccinations, especially for our school children. That's the group that actually remains with the lowest vaccination rate still. So I do see optimism. We're monitoring carefully what's happening, and we will continue to report on this. For more on our vaccination campaign now, I will turn it over to Dr. Urmila Shende, our vaccination chief. Thank you.
Thank you, Dr. Mace. So as of today, a total of 385,495 Sonoma County residents aged 5 and up are fully vaccinated, which is 82% of our eligible population. Another 30,986 residents, or 7%, are partially vaccinated. As Paul mentioned, our fixed site vaccine clinic at the Rohnert Park Community Center is now closed. It was replaced with the mobile vaccine clinic that is operating out of the parking lot of Rohnert Park Community Center on Tuesdays, Thursdays, and Saturdays. Our clinic at the Roseland Community Center will close at the end of June. These changes are a result of the fact that we have seen a significant slowdown in our demand for vaccinations, but our efforts are continuing, particularly in our outreach to targeted populations that have been disproportionately impacted by COVID, and to our seniors and immunocompromised residents who are the most vulnerable, and particularly our youngest residents. With the school year winding to a close, it's even more important to reach students through our school-based vaccine clinics before summer vacation starts. At this time, just 42% of those between the ages of 5 and 11 in Sonoma County are fully vaccinated. That is better than the state average of 34%, but it still leaves much room for improvement. We continue to work with the Sonoma County Office of Education to stand up vaccine clinics at local schools to serve people who do not have convenient or affordable access to healthcare providers. In fact, tomorrow, there will be clinics at J.X. Wilson School and Steel Lane School in Santa Rosa. And on Saturday, there will be a clinic at Healdsburg Elementary School, the Fitch Mountain campus. These events will be open to the entire community, not just students. First, second doses, as well as booster doses and second booster doses will be available. The vaccine is also available at most pharmacies, health clinics, and primary care providers. Wherever you go, the vaccine will be available at no cost to you or your children, regardless of your immigration status or whether you have health insurance. Walk-ups for first and second doses are accepted at most clinics and pharmacies. Residents also may make appointments at the county's vaccine clinic page at socoemergency.org/vaccine or through the myturn.ca.gov website. We also have some clarity regarding the vaccines for children under 5 years of age. Federal regulators have scheduled meetings in June to consider emergency authorization for Moderna's vaccine for 6-month to 5-year-olds and Pfizer's vaccine for 6-month to 4-year-olds. So there's a good chance that we will have a vaccine for our youngest residents by mid to late June. Finally, I'd like to second what Dr. Mace said about the progress that we have made together as a community, and to thank all of you for what you've done to keep one another safe and to protect the most vulnerable among us. We have the 10th highest vaccine rate among the 58 counties in the state, which is a testament to all of the hardworking healthcare providers, community health workers, and community-based organizations, and also to the willingness of our population to do the right thing and get vaccinated, to follow health recommendations and getting tested. Because of you, we have saved countless lives. Thank you. Now I will turn it over to Kate Pack, Sonoma County's lead epidemiologist, to share some data. Kate?
Okay, thank you, Dr. Shende. I'll share my screen. One moment. I wanted to share some of the latest trends in our data. When we look at trends over the past 2 months, so from March 1st of this year to present, we can see this increased transmission in our community. So looking from March to present, we see this incline. As of today, we have nearly 27 new cases per 100,000 residents. And this is based on testing through PCR tests. So this doesn't account for the individuals who tested positive through antigen tests. We've seen similar increases in our test positivity, and looking both overall in our community, as well as in the lowest quartile of the Healthy Places Index. So those are those regions of our community where individuals have less access to resources to promote their health and well-being. We see test positivity at 8% and over 7%. As Dr. Mays noted, although we are seeing increased transmission in the community, we are not seeing that reflected in our hospitalizations. We have stayed steady at about 20 or so individuals hospitalized per day who are positive with COVID-19. As of data reported by the hospitals yesterday, 18 people were hospitalized with COVID-19. And looking since the start of the year, 66 individuals have lost their lives from COVID-19 complications. Looking here at Sonoma County's case rate in the green and the overall Bay Area County case rate in the orange, you can see that in both the Bay Area and Sonoma County, our case rates are trending higher than in the state overall. Looking at state modeling, the modeling predicts that this wave of COVID-19 cases will begin to plateau in mid-May and start to come down towards the end of the month or early June. When we look at how Sonoma County is doing compared to other Bay Area counties, you can see that our case rates are about in the middle. So about half of the counties have case rates higher than us, and a few counties have case rates that are lower than Sonoma County's. We continue to track COVID-19 variants. We don't locally have the capacity to sequence or genotype every COVID-19 case in the county, but we do prioritize samples such as individuals who have been vaccinated but still become infected, or individuals who've traveled internationally or are part of a large outbreak. We sequence those cases to try to understand if there's any new variants entering our county. And since Omicron became the dominant variant in Sonoma County, you can see here that Omicron now accounts for all samples sequenced in our county, this pink shown on the chart. We've seen several subvariants of Omicron appear. BA.2 is the most dominant subvariant in the United States. Locally, it accounts for about 6% of the over 1,800 Omicron samples that we've sequenced so far in Sonoma County. And we know that BA.2 is more transmissible than the original form of Omicron. And we've also seen that BA.4 and BA.5, additional subvariants, are leading to a new case surge in South Africa. Those subvariants have been detected in the United States, but so far have not been detected in Sonoma County. While we're monitoring these new subvariants, research shows that although these variants are more transmissible, so they spread more quickly, they do not appear to be associated with greater disease severity, so likelihood of hospitalization or death. But we continue to watch these variants and look for any new variants that could enter the county. We have good vaccine coverage in Sonoma County, as Dr. Chende noted. Looking at our eligible population aged 5+, 82% of the individuals in our county are fully vaccinated, with another 7% partially vaccinated. So 89% of the eligible population has some protection against COVID-19. As noted, when we look by age group, vaccine coverage is higher in the older age groups. And we see this drop off a bit for the individuals under age 35, and particularly for the 5 to 11-year-old age group, where we still have work to do to bring the vaccination rate up. Looking at vaccination status by race, ethnicity, we've also seen progress made here with about 7 out of 10 or more of individuals in each racial ethnic group having been fully vaccinated. But we do continue to see a disparity with, in particular, American Indian, Alaskan Native, and Latinx groups, with a lower proportion vaccinated than some of our other racial ethnic groups. And that is the end of my slides, and I will turn it back to Paul Gullickson. Thank you.
Okay, thank you, Kate. We appreciate that. So we are going to end our session here. This is our update for today. I really want to thank all of our panelists, Dr. Mace, Dr. Shende, and Kate Pack, for your updates, and for all of you for making the time. I also would like to thank our crew who helped put this together, including Juan, our Spanish interpreter, and Elizabeth, our ASL interpreter. Just so you all know, we will be repeating this webinar in Spanish tomorrow at the same time. If you would like more information on some of the data that was brought up today or other questions, we encourage you to go to socoemergency.org/vaccine. We have quite a bit of information there available to share. And again, if you have questions for us, please feel free to send them to publicaffairs@sonoma-county.org. That's public affairs, one word, @sonoma-county.org. So until our next update, we wish you all well. Thank you for joining us, and have a good week, everybody. Stay safe.